let's talk about how the vaccine gets rolled out. We obviously understand that healthcare workers, frontline workers need to get it first. Vulnerable populations need to get it next. But we have learned in the last 9 months something that you're very clear on, that immigrants, people of color, people without health insurance, people who live in impoverished areas, people who live with multi-generational families don't even get normal health care. They get coronavirus at higher rates than everyone else. They have higher mortality rates than everyone else. We don't have a system that gets these people better health care. We don't have a system that puts these people near the front of the line. How do we deal with that? How do you deal with equity in the distribution of a vaccine?
Well, equity is incredibly important. I mean, the billionaires and NBA players should not be at the front of the line for the vaccine. And most importantly, there's got to be a federal standard. I believe the Biden administration is already working on that. Us locally and across the state, and the governor's been very engaged on this. We are going to get the vaccine first and foremost to healthcare and medical workers, essential workers first. And so really the state's setting up its own framework, and Governor Newsom is doing a great job of ensuring that all of us as cities work together, and the counties as well. But within our own health system here in the city of Long Beach, we've also established our own framework. And so we know that right after those initial batches come, then we know that we're going to also work on folks that are in retirement homes and nursing homes. And then we have plans to get out into those undocumented communities. As it relates to testing, we set up our own mobile clinics going just to communities that are for people that are undocumented. We're going to do the same thing for the vaccine. We'll have mobile clinics. We're using our testing centers to convert them. We're going to do monolingual Spanish and other languages. So it's got to be an effort where we go out to those harder to reach communities.
Yeah, you understand that community well. Got to imagine after the last 4 years, there are a whole bunch of undocumented people who are not English speakers who are quite leery of getting an injection from the U.S. government. I'm not very worried about the statistic, but I'm looking at the statistics of people who will not agree to take this drug. The number of people who the vaccine, the number of people who have agreed to take it has increased now between September and November to 60%. That it's up 9% over that short amount of time. So that's good. And I suspect once people start getting the vaccine, that number will grow to the 70% plus that you need in order to create herd immunity. Does that number worry you? The small number of people who are prepared to take this vaccine?
Absolutely. I mean, I'm hearing from those folks already. And the truth is, it's really a trust of government. I mean, Donald Trump has completely broken trust in government. So you have a lot of communities that typically would be much more likely to listen to the authorities, that are scared, that don't want to interact with the government, particularly when it comes to Latinos, undocumented, and immigrants. They are very nervous about what Donald Trump has done to this country and to our government. So we're going to have to rebuild that trust, and we're going to have to go into communities, speak in their language, work with low-income families, and bring in community organizations that are trusted within communities to get the vaccine out. It just cannot be wait and see. We can't just sit around and wait for folks to come to get the vaccine. We're going to have to go directly into neighborhoods in their language and with a cultural lens to get the vaccine to them.